appreciate it.
Okay, good. Absolutely.
Welcome to my first episode of season 2 of my Lunch and Learn video series. I'm Amelia Maddox. I'm a doula and health educator here in Greensboro, North Carolina. And today I'm very excited because I have my first lactation consultant doing an interview with me. And this is Beth Sanders, who is a lactation consultant with Greensboro Lactation Consultants. And I want you to introduce yourself for us.
All right. Thank you so much for having me. Yes, I'm Beth Sanders. I am a IBCLC, that's International Board Certified Lactation Consultant here in Greensboro. I am in private practice, and I have an office in Carolina Pediatrics, so anyone who is seen there can see me in the office there. Additionally, I make home visits in the Greensboro area.
Oh, wonderful.
And carry around my baby scale and just see people right in their home where they're most comfortable and where I can really help them with feeding in their environment.
Oh, that's so great. I had a lactation consultant with my first 2 babies, and it was so nice to have that home visit.
Yes.
It just, because you don't want to go anywhere after you've had your baby. It's so hard to get all the things together and get out the door.
Right.
So that's such a lovely service to have. So tell me a little bit about what an IBCLC is.
Okay. So an IBCLC is certified by an international board, which means we have required courseworks to take for the certification. In addition to that, we have required minimum number of hands-on hours with a mentor. So this means that every IBCLC that you see has completed much coursework and many hours of supervised hands-on breastfeeding care. So it is impossible to become an IBCLC without having a lot of experience and a lot of book work. So it is an exam that we take once every 10 years.
Oh, wow.
And we have a lot of continuing ed requirements to keep up with our education. So it's a very thorough and pretty rigorous curriculum to keep up with the credentials.
Oh, that's fascinating. And so the coursework is things like biology and anatomy.
Yes.
Okay.
Medical terminology, statistics, and lots of college level courses that many times people will say, well, by the time I get all those courses done, I could be an RN or a registered dietitian or something like that.
And you came from nursing, is that correct?
That's correct. So I got my bachelor's in nursing from Clemson University in 1994, went right into neonatal ICU, and have been in pediatric and maternal care for all of my career.
Oh, wow. That's great. And so you started as a nurse and then became a lactation consultant, worked at a
Women's Hospital.
You worked at Women's Hospital here in Greensboro, and now you have your own practice.
That's right.
And you have another consultant lactation consultant that works with you.
That's correct.
Okay. Well, that's wonderful. What inspires the work that you do?
So I love working with new moms. I always have, ever since the NICU days back in the 90s. We had the baby to take care of, but also nurturing the mother as she was stressed and worried and sad about her baby being in special care. And I love promoting health, and I love promoting mental health and promoting growth of our infants and children. So it was a really good fit for me to go into this field. And I still love all components of it, and kind of working with families to see what is the healthiest balance that we can come up with for feeding the baby while also taking care of the family and making sure the family is working well together.
Oh, that's wonderful. So what does an initial consultation look like when someone calls you up and says, hey, Beth, I really need a lactation consultant?
Right. So one thing I really want new moms to know is that if I'm coming into your home, do not feel like you need to clean up or worry about the condition of your environment, because I'm coming into your space where you feel safest and most comfortable. And I'm also a mother, and I have the pets and the family and the children and the carpool and the sports equipment and all that stuff sitting around too. So
Right.
I get it. So I will come into the home, or if it's in the office at Carolina Pediatrics, we will just meet there in the office. But it involves, I'll take a prehistory, so the mother will have a chance before we meet to give me a little bit of background on what's been going on. One of the most important things for me in that initial consultation is to listen to what has been happening and where that family wants to go from there.
Okay.
So a lot of how'd you get where you are now, and what are your goals moving forward, so that we can form a plan together, and so that she'll know how to proceed after that visit.
Okay.
So the initial consult involves just kind of sitting down and having a chat. It involves weighing the baby.
Okay.
So if the mother wants to breastfeed, then we will weigh the baby before and after a meal.
Okay.
So there's 2 weights involved there, and we get an idea. It's not that we can write it in stone or anything, but it gives us an idea of how much the baby might be taking.
Okay. Because we can't see, when you breastfeed, you can't see how much milk the baby gets, like when you give a bottle. So you have to weigh it.
Right.
Okay.
Right. And with that NICU background, I just don't like guessing.
No,
I don't want to guess. I want to know. I like numbers. I like data. I want to see, here's where we are. Here's how much your baby took. And if this is a full meal and we're good to go, then no worries. If we need to make some adjustments to the plan, then we have the data to make those proper adjustments.
Okay.
Without adding undue stress or concern or guessing about what numbers we need.
Oh, great. So what are some things that, some goals you like to try to set with families?
Right. So with each family, our first goal is to make sure that we have a baby who's feeding.
Yeah.
So we just need to make sure that the baby is thriving, good enough calories throughout the day, feeding often enough, and getting enough milk at each of those feeds.
Okay.
So the weighed feeding helps us formulate that plan. So if the baby's taking a full meal at the breast, that gives us information we need to make that plan. If the baby's not taking a full meal at the breast, then we incorporate other ways to get the baby fed. Another goal that we always are trying to get to is to make sure that the milk is coming out of the mother. So if the baby can't take it directly from the breast, we'll set up a pumping plan.
Okay.
And make sure that she knows when to pump and why. So I think when we know why we're doing it, it makes it a little easier to get the work done. So we'll kind of combine. We're going to breastfeed, we're going to pump, and our third goal is to do those first 2 things where the mother feels like she's got some empowerment and some control and some sanity in her day. So I'm not going to overwhelm anyone with something that I wouldn't be willing to do myself. So we'll say, okay, we're going to feed the baby. This is the method that we're going to feed the baby. We're going to pump, and here's when and why. And we're going to make a schedule that works with your family so that you have time to enjoy your baby and enjoy your partner, and that your partner can enjoy being part of that new family.
Oh, that's great. Because when the person who is breastfeeding is happy, is mentally well, then it makes a greater impact on the family.
Right. That's exactly right. And what I really want to see is, in addition to the baby thriving with all these calories, is I want to see the mother and the partner thriving as well as a family, that they're really enjoying being new parents.
Yes. Yeah.
So I really work with them and say, and if we do have a follow-up, I'll say, how did that plan work for you last week? Where are we? How are you? Was it too much? Was it about right? And then we make adjustments as needed to make sure everyone feels like they're coping and they're thriving really well.
Oh, that's great. So what are some of the common feeding issues you see?
Right. So we see probably the most common concern that I hear is, I don't think I have enough milk.
Oh, okay.
Okay. So, and it's really important to figure out if that perception is based on anxiety or self-doubt, or if there truly is not enough milk.
Okay.
And because we'll handle each one of those differently. So the first thing we'll try to do is figure out, is there enough milk? And if not, Why? And what steps are we going to take to remedy that?
Okay.
Another very common concern that I get is, it hurts.
Yes.
And what I try to teach people in my class and in my prenatal consults is maybe a little tenderness would be considered normal or okay or acceptable.
Right.
But toe curling pain is not part of normal breastfeeding.
Yeah.
Otherwise, I really don't think that we would have made it this far, right? It's just too hard to breastfeed infants through that amount of pain.
It really is.
So if a mother is really hurting, then I really want to come down to, let's figure out why. And sometimes it can be just such a small adjustment in how you're holding the baby, how you're positioning the breast with the baby.
Yeah.
And we can make a lot of progress with just a few adjustments to get that mother comfortable, where before she came into my office, it was excruciating. By the time she leaves, she's saying, that's okay. Actually, that doesn't really hurt that much.
That's amazing.
So dealing with nipple pain is another biggie. And then related to nipple pain and milk supply is, kind of the big topic, the big common topic right now as far as breastfeeding goes is tongue tie and lip tie.
Okay.
And does my baby have tongue tie?
And what is that?
Tongue tie is when there is a little tether, a frenulum, connecting the tongue to the floor of the mouth. Okay, so the tongue. That's right. That's right. And I'm always looking at mother's tongues to see. They don't know I'm doing it, and I'm looking at that mouth to see what does that mother's mouth look like, because a tongue tie can be genetic.
Okay.
And lip tie is the same thing. So the lip is kind of connected to the upper gum.
This part.
That's exactly right.
Okay.
That's exactly right. So that when you flip the lip open to try to mimic a latch, the lip is really tight. Maybe it's stretching, maybe it's blanching white or red because it's under tension.
Okay.
And I'm lifting up that tongue. I will do a thorough inspection of the baby's mouth, lips, tongue, and even looking into the neck, shoulders, and back to see how the baby is aligned, and looking at that oral anatomy in relation to the mother's anatomy to see how those things line up.
Oh, interesting.
See if I believe that a tongue tie or lip tie is affecting breastfeeding in a negative way. We do have treatment options right here in Greensboro now, so I can talk to the parents about how to make that, how to get that remedied.
That's fantastic. We had, so my second baby had a tongue and lip tie. And at the time this was 6 years ago, we actually had to go to Charlotte to get a laser procedure done so that we could remedy it, and it made a huge difference. Now he was feeding very well in terms of getting enough milk, because thankfully had an abundance of milk, but it was not comfortable, and he was getting very tired. This is how we knew, because he would just he would get so tired from nursing, because he was having to work a little extra hard. As soon as we got the procedure done, immediate difference. And he had longer feeds and was more satisfied and didn't just pass out.
Right. It can make a huge difference when the tongue is doing what it really has to do to get milk out of a breast. It can make a huge difference.
And our insurance was able to cover the procedure.
Perfect. Well, you don't have to go to Charlotte anymore. That is an option. Woo-hoo. But we've got some local resources now in Greensboro, which is great. That's tremendous help.
That's wonderful.
Yeah.
Well, Beth, thank you so much for joining me today.
Absolutely. Thank you.
Yes, you've given us so much wonderful information. And can you also tell us how folks can contact you?
Absolutely. So they can find me online at greensborolactation.com.
Okay.
They can find me on Facebook, also Greensboro Lactation. And they can call or text me. I know most people really love texting, and that is perfectly fine with me.
Awesome.
At 336-338-7703.
Oh, thank you so much,
Thank
Beth.
you so much.
Yes, and you can also contact me at ameliamaddox.com. That's my website. All of my information is there as well. And look for more episodes of my Lunch and Learn series. I've got more wonderful guests coming, and I'm very excited for what I have for you this season.
Thank you very much.
Thank you, Beth.